how do rising medical expenses affect Indian households?
Not more than 10 to 12% of Indian households have access to private health insurance. We at SAVEin are building at the intersection of healthcare and financial technology.
What role do you imagine fintech playing in healthcare accessibility? Women suffer from more fatal diseases than men, especially women who is not a working woman, who is a homemaker.
More than 75% expense in healthcare is borne out of pockets. So imagine you have been served a bill of, let's say, 100,000 rupees. So instead of paying 100,000 or 1 lakh rupees in one go as a down payment, what if you could avail that treatment and you could pay that 100,000 rupees in, let's say, 12-month installments?
What's that one tip you would like to tell everybody in terms of managing healthcare and finance? Hi everyone. Imagine a world where healthcare affordability wasn't a concern. Today, in our exclusive interview with Project Leaders Magazine, we have Jitin Bhasin, visionary CEO and founder of SAVEin, who is revolutionizing healthcare affordability through innovative fintech solution to millions. Welcome, Jitin. I hope you're doing
Thanks,
fine.
Maheshri.
So, Jitin, I want to begin our conversation today by understanding your perspective on medical expenses because it's quite expensive, right, in today's era. And a lot of people do not have insurance and they are not even aware that something like health insurance exists and it's not applicable for every kind of disease, right? So, can you tell me how do rising medical expenses affect Indian households?
If you see at a particular individual level or at a household level, Maheshri, healthcare forms a substantial component of a household expense, right? So let's say on an average, we have seen that individuals and families end up spending about 20% on medical and healthcare on a monthly basis. And this is standard when there is no specific treatment or emergency or otherwise, etc. So healthcare in India is a $100 billion market. And as you rightly
Okay.
said, India is grossly underinsured market. So less than 1% of GDP goes towards health insurance premium in India. So that's a very, very significantly underpenetrated market. And not more than 10 to 12% of Indian households have access to private health insurance. So more than 75% of healthcare expenses borne out of pocket. And healthcare is expensive, right? Healthcare is very expensive. Medical inflation is about 16% in India, 1/6. So it's only getting more expensive. So what happens is you have to spend a lot of money out of pocket, and this
Yeah.
is only becoming more expensive with every passing year. So therefore, this becomes a very significant challenge for individuals as to how do they manage their healthcare expenses. So yeah, I think that's a very acute problem.
So, what role do you imagine fintech playing in healthcare accessibility?
More than 75% expense in healthcare is borne out of pocket. It makes for a very compelling case for people to have access to embedded finance or
Okay.
real-time finance for availing such healthcare procedures. So if you see in India, Maheshri, you can buy a mobile phone on EMIs. You can buy cars on EMIs. You can buy furniture on EMI. You can, buy a laptop on EMI. And there is
Yeah, true.
everything possibly that you can buy on EMI, right? But why not
Correct.
healthcare? So why can you not avail quality healthcare and pay for it in more affordable means? Why can't you split your payments towards healthcare into affordable monthly installments? So I think fundamentally we at SAVEin are building at the intersection of healthcare and financial technology. And we believe that making on-demand credit available to people when they want to access any healthcare service, any healthcare treatment, is going to revolutionize how Indians consume private healthcare. So
True.
imagine you are at a particular clinic and you have been served a bill of, let's say, 100,000 rupees. So instead of paying 100,000 or 1 lakh rupees in one go as a down payment, what if you could avail that treatment and you could pay that 100,000 rupees in, let's say, 12-month installments? So I think that is a very, very powerful mechanism by which we believe that Indians will consume healthcare more efficiently. And at SAVEin, we actually offer zero cost EMIs. So how you
Yeah.
buy a mobile phone, how you buy Apple phones, right? You can get zero cost or 0% interest monthly payment plans can be made available for private healthcare And I believe that is liberating, that is revolutionizing, and that will change the complexion of how Indians plan for private healthcare expenses.
Can you tell me what is this major crisis in the healthcare sector that nobody is talking about as of 2024?
So I think the one thing that nobody is talking about as passionately as we must is that there is a lot of work that can be done outside of a hospital. There is work
Okay.
that an individual needs to do in the day-to-day life because there is data which tells you that a normal human being does not spend more than 25 to 26 calendar days in a hospital in one's full lifetime on an average, right?
Okay.
So I think the bulk of the problems are outside. The bulk of the problems are on daily basis, how you deal with your daily health, your daily fitness, your daily diet, your daily mental health, and how efficiently you deal with frequent healthcare, which we call as preventive or elective healthcare. How do you deal with
Hmm.
those items? I think if we as a society decide to talk about those items which can help us prevent getting hospitalized, I think that is the next big boom that India needs because
Yeah.
once you're hospitalized, you've possibly already lost half the battle, right? The key is to prevent acute diseases. The key is to prevent lifestyle disorders. The key is for you to lead a healthy life. And I
Hmm.
think that's the area that we at SAVEin are passionately solving for. We at
Yeah.
SAVEin focus solely on outpatient healthcare, which means that the healthcare and services that you avail outside
Hmm.
of hospital. So I think this is the most disruptive area, and probably for the next few decades will remain very important.
Yeah, even I feel the same. And now that we have spoken about the healthcare industry, finance, insurance, right, how it affects lifestyle, I really enjoyed that part. Now I want to come to the second part and understand your brand story. Like, can you give me a behind the scene of how you created SAVEin?
Yeah, look, I have been in the banking and finance, specifically fintech industry for almost 15 years now. And I am a second time founder, which means I have founded another company before this as well. So, and that was a
Okay.
fintech lending company. Yeah.
Okay.
And when I say fintech lending, so we had a mobile app based lending company. And also I used to run a non-bank finance company. So I was very clear that now we are at a stage, the world of our generation has seen
Mm.
an extinction level event, an event where people thought they may die. And I think a lot of people that I met, I interacted with, I could see that there is a very discernible change in how they are now talking about healthcare,
Yeah.
right? And I think in India, the quintessential fight for roti kapda makan is largely over because there is enough, let's say, avenues for people to make money, both in urban and also in rural setups. And we've been growing
Yes.
at 7 to 8% GDP growth for the last decade. So we as a country have been growing consistently. And if you see around yourself, there's prosperity, right? We were very clear, So personally, I was very clear that now is the time for premiumization and consumption of healthcare. Now people will start prioritizing health over everything
Yeah.
else because they've seen an event that what if you don't prioritize health, what happens when you do not prioritize health. So I think
Correct.
that is the story behind Seven, Maishri. We figured out that India requires a platform where people can connect with the best healthcare facilities, access those healthcare services at a time of their choosing, and pay for
Mm.
those healthcare facilities in a way which is easy on their pocket, which means they can enjoy the best care, they can choose the treatments, they can choose the services that they want, and they can also do it without worrying about high upfront expenses. So we combined the two. So we combined the healthcare industry and the fintech experience that I had, and we decided to build India's first healthcare fintech focused on making outpatient healthcare disruptive. Because if you're hospitalized, you can get insurance, right?
Yes.
But what about hundreds of treatments that you have actually outside of hospital, which
Yeah.
insurance does not cover for, insurance doesn't
True.
pay for, right?
Yeah.
So I think that is the story behind Seven. We want Indians to lead healthy lives. We want Indians to be happy. We want them to be happy in their skin, happy inside, happy outside. And for that, I think that's the story of building Seven.
Hats off to you for taking this initiative and making people's life easier.
Yeah. No, thank you.
Also, yeah. Also, I went through your website and I came across the Care Now, Pay Later model. Can you quickly give us a quick brief on how it works
Yeah,
and what are its features?
yeah. So, Maishri, what we have done is we have created India's largest network of outpatient healthcare facilities. So, more than 6,500 healthcare centers are now affiliated to SAVEin. And what
Hmm.
happens is we place a QR code at that particular center, and
Okay.
that center is also listed on our website.
Okay.
Okay, like a marketplace. So what
Hmm.
happens is, let's say Mayashri Paul wants to go to a dermatology center for some skin treatment, right?
Okay.
And she goes to SAVEin and she discovers that there is a VLCC center in Shillong next to her house, which she would like
Hmm.
to go to. So she
Okay.
can make a booking for that particular center on SAVEin. And when
Hmm.
she goes to VLCC, let's say center, she will seek the right guidance from people there. They will understand your requirement, they will prescribe a treatment, and let's say a cost is established.
Yeah.
Now, by simply scanning the saving QR code at that particular center,
Hmm.
you can unlock a credit facility which can be used at
Okay.
that particular center. So we look at the credit history of the person. Within 2 to 3 minutes, we are able to allocate a credit facility to the customer, eligible customers,
Hmm.
right? The customer, let's say you go and or the customer goes and scans the QR code and gets a credit of 2 lakh rupees, for example. And if
Okay.
somebody was to spend, for example, 60,000 rupees out of that 2 lakh, so simply by completing the process in a completely digital, secure, paperless manner, the person can choose to pay that amount directly to the center using SAVEin without any down payment. So you could
Okay.
get the treatment. Let's say your treatment costs for 60,000 rupees. You could get the treatment worth 60,000 rupees at a dermatologist, at a dentist, at a hair specialist, at an eye specialist, at a fertility specialist. IVF is also what we do. You can go to a gym and you can take subscription or personal training or gym membership, right? You can buy
Hmm.
hearing aids for your parents or yourself if somebody needs. So we have
Hmm.
created this network of healthcare facilities where you can simply go, scan, unlock credit, pay through it, and repay in easy EMIs. Between 3 months to 18 months EMIs is what we offer. So we
Okay.
give people credit up to 5 lakh
Huh?
rupees.
Is it like a no cost EMI?
It's a no cost EMI. This is like how you buy how Indians were used to buying iPhone, right? So
Yeah.
65-70% iPhones are sold on no cost EMI. How does that
Yeah.
happen? Because that particular product is subsidized by the manufacturer. Similarly,
Correct.
we work with healthcare providers
Hmm.
and we seek subsidies, we seek discounts on the service cost, and we use that discount to give a zero cost experience to our customers.
Got it. That's really nice.
Yeah.
I would like to shift to the next section of our interview, that is the rapid fire round. And you have to give only one word, and the answer has to be quite quick. So, you ready? We'll begin.
Yeah.
One healthcare challenge India must tackle.
Affordability.
Most influential leader in healthcare.
Narayan Hridyalaya.
Secret to balancing business and social impact.
Persistence and aggression.
What's SAVEin's most impactful feature that you want to tell the world about?
Access and affordability to top class private healthcare.
Can you tell me best part of being a CEO is?
To make something people want.
Healthcare industry's biggest leadership challenge that you think anybody would face or you have faced?
Ensuring transparency in medical care.
Two advice for aspiring healthcare entrepreneurs.
Healthcare is a long term commitment, so choose wisely.
Define success in healthcare innovation.
Making sure that Indians can consume the healthcare that they want at the place and time of their choosing without worrying about the expenses involved. That's impact.
Okay. Cool then, Jitin. I think I had a great time talking to you.
All the best to all of you and keep doing well.